Good morning, everyone. Let me introduce myself first. I am Rajni Rajput and I am here to talk to you about an interesting topic, wound dressing. It will help to you in the clinical sides. So now we move on the topic. In that first, wound. An injury to a living tissue caused by a cut blow or other impact, typically one in which the skin is cut or broken. In that, an injury to a part of your body with the weapon or an accident in which the skin is cut or broken. After that, meaning of wound dressing. In that, sterile dressing covering applied to a wound or incision using aseptic technique with or without medications. In that, sterile pad applied to a wound to promote healing and protect the wound. And aseptic techniques, it means not having any harmful bacteria while you applying this sterile dressing. After that, purpose of wound dressing. In that, first, to promote wound granulations and healing. Promote, it means support. Granulation means it means inadequate blood flow occurs. In that, tissue may be pale in color. Healing means make healthy again. So it will help the wound for the granulations and make the healthier again. After that, to prevent undue contaminations of wound. Undue, it means more than necessary, and contaminations, it means contact with the unclean things. Wound dressing decrease the contact with unclean things more than necessary. Next is to decrease purulent wound drainage. It will decrease the pus formation from the wound. After that, to apply the medications on the wound, it will help to prevent the infections. After that, to prevent or provide comfort, it will help to shore up the mood or physical state of someone else. Next is to prevent infections. Wound dressing prevent from the further infections. These are the purposes of wound dressing. Now we will see the principles of wound dressing. In that, first, practice strict aseptic techniques to prevent infections. In that, to prevent infection, make sure that not having any bacteria on the wound side. After that, all articles should be disinfected. All articles should be sterile. Next is a wash and before and after procedure to prevent the infection. After that, instrument used one dressing cannot be used another until they have been re-sterilized. If you used any articles for the dressing, then make sure that articles cannot be used for another until they have been sterilized. Next is use mask, gown, gloves for the large dressing to minimize the wound contamination. Mask, gown, gloves used for the prevent the infections. Next is use individually wrapped sterile dressing and equipment. You have to use packed and sterile dressing for the patients. These are the principles for the wound dressing. Now we will see the types of dressing. It is divided into 5. Gauze, non-antiseptic, antiseptic, pressure and self-adhesive transparent dressing. In that, first, gauze dressing. Gauze is a loosely woven that used to bandage the wound. Also, it can be used to clean cuts and the burns. After that, non-antiseptic dressing. It is non-irritant. It will used for the burns and the pressure ulcers. Next is antiseptic dressing. A sterile dressing of gauze with using of antiseptic solutions. Next is a pressure dressing. In that, a thick pad of gauze or other material placed over the wound and attached firmly so that it will exert the pressure. After that, self-adhesive transparent dressing. In that, it is typically used to protect the skin in the pressure spot. These are the types of dressing: gauze, non-antiseptic, antiseptic, pressure dressing, self-adhesive or transparent dressing. Now we will see the preliminary assessment of the wound dressing. In that, first, level of consciousness and understanding of the patients. Ask the patient about their name, age, place. It will help to understanding the patient's conditions. Next is a vital sign. To check the patient's vital sign like a temperature, pulse, respiration and blood pressures. Next is a allergy to tap or cleansing solution. In that, ask the patient for any allergic reactions. After that, bleeding tendencies. In that, check the clotting time or process of clotting time of the patients. Next is a doctor's order. To check the doctor's order for the dressing procedure. After that, bleeding or drainage of wound site. To check the bleeding or any pus formation from the wound site. Next is a condition of the wound. Check the condition of the wound of the patients, like any reactions of the patient, edema, itching. It will help to prevent the further infections. These are the preliminary assessment of the patients. Now, preparation of the patients as well as ward. In that, first ensure that sweeping and mopping of ward is completed. It means ward should be clean and wipe. After that, explain the procedure to the patients. It will help to reduce the anxiety of patients. Make sure that all articles should be near on the patient's bedside. After that, proper lighting of the ward, provide privacy by using the screen. After that, fix disposable plastic bags in the holders on the trolley. It will help to discard the dressing material. These are the preparation for the patients as well as ward. Now, articles. Which are the articles used in the dressing procedure? It should be divided into two, sterile as well as non-sterile or other. In that, sterile articles, first artery forceps. Artery forceps used for compress an artery to stop the bleeding. Next is a scissor. It helps to cut the various thin material. Safety pin. It will help to secure the bandage. After that, non-toothed thumb forceps to hold or move the tissue during the dressing procedure. After that, cotton ball. It will help in apply the medications or ointment. Next is a gauze piece. It will protect the wound. After that, pads used to stop the massive bleeding. After that, glove, mask and gown. It will protect the nurse as well as patients from the infections. Now, other articles is that cleansing solution and sterile solution. Cleansing solution and sterile solution both are used for the clean the wound. After that, prescribed solution for dressing the wound. It will help in the dressing procedure. Adhesive tape. It will hold the wound bandages. After that, sterile gloves to prevent the infection. Plastic bag for waste disposable. It will use to discard the waste material. Next is a Macintosh. Macintosh placed under the patient's wound to prevent the infection from the bedside or the patient sides. Next is a kidney tray. It will help to remove the waste material or any infections material. Next is a Chittle forceps. It will help to remove the sterilized instrument from the boiler. Next is a drum with the gauze piece. It will help into the dressing procedure. Now we will see the step by step wound dressing procedure. In that, first give the comfortable position first. After that, wash your hand thoroughly. After the hand washing, put the gown, gloves and masks to prevent the infections. After the wear gloves, mask and gown, open the sterile tray. Take the sterile towel and spread the sterile towel around the wound. After spreading the sterile towel, pick up the dissenting forceps and remove the old dressing. After that, discard the dissenting forceps in the bowl of lotion to prevent the infection. Whenever you remove the old dressing, not the type and amount of the drainage present. It will help to prevent the further infections. After that, note and type of amount of the drainage. Ask the assistant to pour some amount of cleansing solution into the bowl. It will help to cleanse the wound. Now after that, clean the wound center to periphery, and each swab stroke used for the only once time. After that, cleansing the wound, you dry the wound with the dry swab. After drying the wound, apply the medication if doctor prescribed, and apply sterile dressing. After that, remove the gloves and discard it, and secure the bandage with the bandage or tape. These are the step-by-step procedure for the wound dressing. In that first, again I will repeat, in that first, give comfortable position. After that, hand washing. After that, wear gloves, gown and mask. After that, open sterile tray, spread the towel around the patients, take the descending forceps, remove the old dressing, remove that dressing material on the paper bag. After that, take some solution for the cleansing the wound, clean the wound peripherally, each stroke used for the only once. After that, dry the wound. After drying the wound, apply the medications. After they apply the medication, sterile dressing should be applied. Remove the gloves and secure the bandage with the bandage or tape. Now, after care of patients and article. In that first, make the patient comfortable, give the comfortable position to the patient, ask the patients for any complications. After that, replace the all articles in the utility room, as well as discard the disposable articles. After that, hand wash thoroughly. Next is document the type of dressing, condition of wound, types of exudant and patient response. It will help for the further research. After that, repose in any abnormality observed. If after the dressing procedure, if any abnormality is observed, then report to the doctors. These are the aftercare of patient as well as articles. Thank you. Thank you for the listening my audio visual aids. I hope it will help to you in the clinical sides. Thank you. Thank you so much.